What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, July 19th, 2023. We do have several things to share with you today, including Texas, which on Wednesdays, as you know, Texas usually does provide us with their weekly update. We do have New York State data today, and we do have a bunch of news stories. But first off, we do want to go to India. And actually, India's active cases have actually climbed to 1,464. So they're actually starting to see a slight rise in cases again. So we'll see what happens with that. And they have added 49 new infections today, and the death toll in India is at 531,915. We do have a new COVID positive to report. Actually, multiple COVID positives. First off, a Beck Urine has canceled her New York concert after testing positive for COVID-19. Then we come over to this, and I think I do want to play some of this video for you. This is from C-SPAN, so we got to give credit to C-SPAN. The White House says COVID testing protocols still in place after Israel delegation members test positive. Hopefully you'll be able to hear some of this, but check this out. This was yesterday.
We were informed shortly before going into the Oval Office that several members of the Israeli delegation tested positive for COVID. Can you tell us whether President Herzog was tested before his meeting, given the close proximity to President Biden?
So as you know, we have testing protocols when anytime somebody meets with the president. So I can tell you that anybody who meets with the president does indeed get tested. I do. We all do. Any specifics, additional questions about what occurred amongst the Israeli delegation, I would certainly refer you to them.
Thank you.
We're not in danger though, right?
Okay, that's all you need to see. So, two things of interest there. They are still having testing protocols done at the White House. But meanwhile, they say it's safe for us to go back to our normal life. The pandemic's over. All has moved on. Well, if the pandemic's over, why do you still need testing protocols at the White House? And yes, I know, someone's going to comment and say, it's the President of the United States. I get that, but again, they are taking this very seriously. The White House knows how serious this is. And then at the end, did you hear that little joke at the end? I don't know if you want to consider it a joke or not. I laughed at it when I first saw it, but they're saying, we're not in any danger, right? Hello. Anytime you're in a large gathering together, you're always possibly in the danger of COVID. Now we come on to this. Long COVID presents unfathomable burden as healthcare system reaches boiling point. And yes, long COVID is still a big deal. We're not going to read this whole story, but basically what the story goes on to say is someone had COVID. They thought that they were going to recover and have just, a mild infection. That, quote, mild word again. And they did recover. Then a few weeks later, they got sick again. And continuing on, they basically were disabled by COVID, and now they are suffering from long COVID. They're struggling to do basic things. And this is what I keep trying to warn you about, trying to tell you about, because I want you to prevent yourself from getting infected. I don't want this to become you. I don't want one of my regular subscribers or people who constantly come in to say, yep, I got infected and now I'm dealing with the problems. I want to help keep you safe. And one way of doing that is to prevent yourself from getting infected. Now we move on to this in Canada at Etobicoke General Hospital. There is a COVID-19 outbreak being declared in the cardiology unit. Yes, the cardiology unit is now having a COVID-19 outbreak. That's not a good place for there to be a COVID-19 outbreak. And check this out. This is from Cedar Rapids, Iowa. Buildings still vacant due to COVID-19 pandemic. We're just reading a headline here, but they still have buildings that are vacant. So again, is everything back to normal? I don't think so. And speaking of things like this not being back to normal, we will probably have our staffing shortage update I'm thinking maybe on Saturday. That seems to be when we were doing those, and I think we're overdue for one. I just did a quick little search and just at page 1 yesterday of Google. It was like, oh my, it's still such a disaster. All right, here we go. Check this out. COVID cases at Western Isles Hospital as healthcare workers in Scotland call for a return to masking guidance. And remember yesterday we talked about they want masking to come back? Well, COVID cases are rising in hospitals in Scotland once again. And then we come to this finally in the news category. Country artist Jason Aldean reschedules Hartford concert after a health incident. Surprise, surprise. Another performer having a health incident. Now taking a look here at the air quality. We like to do this. We like to see who's having bad air quality and where it's not safe to be outside. And today we do see less areas of concern. Still have elevated levels of bad air quality in the east, but it's not as bad as it was the past couple days. We're now starting to see increasing concerns on the west coast, and that's because it is now wildfire season. And take a look up here in Canada. We do have a lot of bad air quality readings in the western portion of Canada, especially further north. Wow, northwestern territories. That's really bad, and unfortunately, the winds are eventually going to shift back out of Canada. There'll be another wildfire episode, smoke episode, probably within the next week or so. All right, let's go over to Walgreens, shall we? Let's take a look at a few of the sites at Walgreens, a few of the states, I should say. Nationally, Walgreens positivity is at 33.7%. Prior week was 32.5%. That was up 1.1%. Total tests, 1,753. That's higher than the 1,426 from last week. And let's take a look at Texas. Since we're going to be talking about Texas today, the current week's positivity is 33.1%. Prior week was 31.9%. That's a difference of up by 1.2%. Total test is 293. The prior week was 210. How about California? California is at 39.1%. The prior week is at 43.7%. That's a difference of down 4.6%. The current week's testing is 197 versus 158. So testing did rise. Taking a look at Oregon. Oregon is at 21.4% positivity this week, 18.2% last week. That's a difference of up 3.2%, and this is a legitimate rise because testing is up. 14 tests versus 11 tests last week. How about Virginia? What's going on there? Virginia is at 24.2% this week, 15.4% last week. Difference of up 8.9%. That's a big increase, and unfortunately, it's a legitimate rise. Current week testing is 33 versus 26 last week. We'll do a couple more here. Michigan, the positivity is actually significantly dropping. 6.3% positivity this week, 26.1% last week, down by 19.8%, and 16 tests this week versus 23 last week. That is a legitimate drop. Let's take a look at Wisconsin. This will be the last one that we do today. Current week, 20%. Prior week, 19.4%. That's a difference of up 0.6%, but testing is down by a good amount. 25 tests versus 31 tests. All right, moving on. As you know, most wastewater sites in this country are rising. The most rapid rise at this point, which is basically a catch-up to what was already happening in the rest of the country, is the West Coast region at this time. And taking a look here, we will get an update here from this CDC surveillance for wastewater sites here on the right. Again on, I believe, Thursday or Friday. And there are 4 in the red, 37 in the orange. Then you have that light shade of blue, which is at 129. So the higher categories are on the rise at this time. And we will hopefully get another update on the variants later this week as well, probably on Friday, with EG.5 quickly becoming a concerning variant. And I think at some point EG.5 could be the next one that becomes a dominating variant. Right now it's at 13%. The dominating variant right now is at 17.5%, and that is XBB.1.16. As you know, emergency department visits they're up across the country. And if they're not up, they're stable in most other areas. Very few places are they actually dropping right now. We only have 6 on the map that show a drop, and there are 3 or 4 places, if you include Puerto Rico, that have failed to provide an update. Let's take a look at some of those wastewater sites that show other things. Yes, there's a site where we could do that. And we like to take a look here at various different sites just to see what other things are doing in wastewater. So I'm going to move myself to the left. Here's South Parker, Colorado. Population served here in this sewer shed is 25,000. And remember, this does not include people that have private septic tanks or private sewage systems. Coronavirus is flat at this time. Influenza not being detected, RSV not being detected, HMPV is no longer an issue there. Monkeypox is not being detected, and norovirus, it is being detected at some low levels and slightly rising. And I should say again, though HMPV is not an issue right now, it could come back at any given time. It's just not being detected at the moment. Let's take a look at 2 more sites we'll do today. How about we come down here and check what's going on in Kentucky area today? How about Louisville, Kentucky? 423,913 people serviced in this watershed. This is a pretty big one. Coronavirus, unfortunately, is rising. Influenza is dropping. RSV is not being detected. HMPV is not being detected. Monkeypox not being detected. And norovirus, it's there, but it's dropping at this time. One more wastewater site. And where is that going to be today? How about we come down to Texas? How about we go closer to the Houston area? Shall we? Let's see what's going on there. Coronavirus is rising at this time. Influenza not being detected. RSV not being detected. HMPV no longer being detected. Monkeypox, not an issue. And we do have some norovirus being detected, but good thing is it's dropping at this time. So I wanted to take a look here. Reason why we did Texas at the end, because today is Wednesday. It is Texas Day. So we do have the Texas update, which is coming shortly. Just a few more things we have to look at first. And first of all, New Jersey, check this out. New Jersey today did report 69 out of 70 of their hospitals after that big issue they had yesterday. 184 people hospitalized, 7 are on a ventilator and in the ICU, 14 people are in the ICU. Going to move myself back to the right now. We need to take a look at Philadelphia for today, and unfortunately, again, over 800 calls, 811 to be exact. Let's do a live looking at what's going on in the burbs. Here's Montgomery County. There are currently 12 calls at this time, and I am seeing several cardiac emergency calls. That's not good to see. Let's see what's going on in Chester County. We got sick person, we got another sick person, and another sick person, and an unresponsive person. Not a good set of calls going on at the moment right now. In New York State, bad news. 789 new cases today, not including reinfections, at-home tests, or people that just don't bother to get tested. So yes, cases are definitely on the rise in New York State. 7-day average positivity is 7.1%, as is the 24-hour positivity. So that's not good either. Taking a look at hospitalizations in New York State, you can see, first off, New York City, 187 people in the hospital, 28 people in the ICU. Now let's go to the state-wide level, shall we? And of course, it's going to refresh, so let's zoom this back in to make it easier for you to see. And you will see here, today 440 people are in the hospital, 56 people are in the ICU. That is just an ever so slight change in the number of people in the ICUs, and hospitalizations are actually the same as yesterday. All right, drum roll, please. Here's Texas. And yeah, Texas, bad news, bad news. Texas, their cases are up 644, higher than the previous week. Current week is at 5,361 cases, and that is likely a significant undercount, because I will show you why. Coming down here, hospitalizations increased by 74. 592 people in the hospital versus 518. So if we know hospitalizations are starting to increase faster, we know the cases, they're just being undercounted. At-home tests, people not getting tested. Remember, this is Texas, my friends. Texas, it's a mixed state. The metropolitan areas, while they may be Democrat, we do have a lot of rural Republican areas where people just refuse to get tested. And we also have this 19 fatalities. The fatalities are still dropping. 19 versus 23 last week. Alrighty, let's take a look at some international cases. We've been watching international cases starting to rise today around the world. They're down 8%, and weekly deaths are down 44%, but we definitely have some places where they are rising. South Korea, it's just down 0.5%. Deaths are down 5%. Brazil, cases are up 2%, deaths are up 4%, and Singapore, this is not good to see. 99% increase in cases in Singapore, and they are not reporting any deaths this week. New Zealand, as you saw yesterday, I'm not sure why it's saying cases are down in New Zealand. That's not true. Cases are actually up at this time in New Zealand. Australia, it's saying here cases are down 80% in Australia and deaths are down 60%. Not certain I'm buying that either. Would need to do some more research to see if that is actually true or not. Belgium cases are up 24%. Chile cases up 15%. Again, no deaths reported there. Switzerland also no deaths reported, but a 12% increase in cases. And then continuing on here, we do have Iran, cases are down 24%. Denmark, cases are up 23%, and they have 9 deaths versus 1 death. That actually works out to an 800% increase in deaths. And Cuba, cases are down by 39%. And let's just briefly take a look at the CDC flu tracker. Set updates here, and we can see there are moderate levels of flu still over in Puerto Rico. Alrighty, where do we stand right now? We know across the United States, we've taken a look at several different factors. We've looked at Walgreens, we've taken a look at wastewater. Right now, I think it's safe to say we are on the rise of another surge. When we take a look at the various different variants, let's go back to that. I think EG.5 right now, to me, seems to be the most concerning because of how fast it is just coming into play. I mean, it's already at 13%. It'll be very interesting to see where it's at the end of this week. I don't think it'll be at 20% yet, but could it get close to that? Maybe it will. So I definitely think we're in another surge. We're seeing what's going on in Texas. Let's go back to that. The South usually sees a rise at this time of year. The fact they rose by 74 hospitalizations versus last week, that's concerning to me because we know testing is not perfect in hospitals. Not all hospitals are testing patients upon entry, or upon admission, I should say. So that is of concern, and that's leading me to believe that the number of people with COVID in the hospital in Texas or anywhere right now is likely a lot higher. And if we go back here to one last factor, I mean, look at this. This is going to update tomorrow. And emergency department visits, they're just going up everywhere. So we're definitely in a surge right now. In some places, it's likely hidden because testing is just so lousy. The biggest surprise out of all this is 2 days in a row, we didn't do it today, but yesterday and the day before, we actually reported West Virginia having some COVID clinics. In other words, meaning they're actually having free testing sites. That's fantastic. If a Republican West Virginia can do that, come on. Why can't we get that going on in the rest of the country? It's time. It needs to happen. There's a surge right now. At least do it during the time of a surge. At least hand out more at-home tests so people can get tested. The fact that testing at a drugstore is not free anymore, that's just totally ridiculous. And hopefully you're one of the lucky ones. Maybe your insurance will still cover it. Alrighty guys, that does it for today's pandemic update. We'll have another pandemic update again tomorrow. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see this life-saving information, because let's face it, there's too many people in denial thinking that it's over with when I clearly just showed you the pandemic is not over with. By all means, share this with them to help get the message out that the pandemic is not over. I'll see you all again next time. But until I see you again next time, stay safe, everyone.